Thank you. So we heard from Dr. Nama and Dr. Rajlakshmi the interventions in diabetic retinopathy. I would dwell in few minutes on something which we have been working on last about 2 years, on another place where AI is rapidly striding, that is in genomics, and how it can be translated into a eye care intervention. So actually last few days, this is, I don't know why it is becoming dark, but inside it is written there is machine learning, deep learning has really picked way, and why it has done is because of increase in the big data, the computing powers, the mathematical modeling, the social media, IoT and automotive industry all have really improved. And last decade that has translated into improved capacity of speech recognition, image recognition, motion recognition, and 2020 the buzzword is the natural language processing, and that has really paved way for many of these algorithms. It's not only eye, but if you look at last couple of years, there have been many devices which are based on artificial intelligence which have got a FDA approval. You can also see there the IDX device for diabetic retinopathy screening. Currently, the applications of AI in retinal diseases is mainly screening of the disease. You must understand there are two different aspects, screening and diagnosis. Screening is somewhere where you go to the community or on a mass screening, and diagnosis is done by an ophthalmologist. It's also helping us in diagnosis in a couple of ways, and it's paving its way the way we manage. Coming to genetic influence, especially on the retinal diseases, broadly we have monogenic diseases where you have one gene which is defective, or complex diseases like glaucoma, diabetic retinopathy, which are called as multifactorial disease, where we know there is an impact of genetic factor also. And the genetic testing, which has also become very common in India today, is indicated in this monogenic disorders today. Looking at only the retinal diseases, currently genetic testing is able to identify nearly 60 to 80% of inherited retinal diseases. So 80% of our patients, if we routinely do a genetic testing, we can know the diagnosis, and it has got certain implications which are given here. And at Shankar Nethralaya, we have been using the next generation sequencing, and nearly 85% of our hereditary retinal diseases, we have a genetic diagnosis. Where AI can play a role is from the variant calling or a genetic annotation, genetic or variant classification, and a phenotype, genotype correspondence, or a genotype to phenotype prediction. And what I'll be talking more about would be the last two things, which some of the work which we have done, the genotype to phenotype correspondence and predictions. So the correlation is done either based on clinical features, which can be a EMR or a demographic data, investigative tools like autofluorescence, fundus photography, electrophysiology, or tools like OCT. So correlating that with the genetic diagnosis. So this was a work which was done where people tried looking at a most common Stargardt's disease, which has got a ABCA4 mutation. And we know that if a person has ABCA4, we do give him a counseling, don't go to the sunlight, avoid ultraviolet B because it increases the progression of Stargardt's. We also know that these are the patients, definitely you should not give any vitamin supplements because the disease progresses more fast. So a simple way is we do a OCT, and there are a couple of mutations which are common, the ABCA4, the RP1L1 or EYS. So this study actually looked into, can we create an algorithm which can detect ABCA4 mutation the moment we show the the OCTs. And it again had a training and a test accuracy group, and what you can see, the accuracy for identifying ABCA4 was 100%, very high accuracy. Means if you use this algorithm, put it for OCT, it can tell 100% of time if it is ABCA4 mutation. So these are some of the images. This got published, and there was little overfitting of this model. I'll not go in detail why. Another work which we have been working is with a company called as Skylome, which is again using the OCT and the retinal photographs and the EMR data from the whole genome sequencing and whole exome sequencing, and trying to predict what the phenotype is all about. Also, there is work on genotype to phenotype prediction. Now, I'll tell you example how. So we all know that about 10% of the people who have dry AMD over a period of 10 years, they either go towards choroidal neovascularization or they go towards geographic atrophy. And this was a work which was done in Europe. They tried looking at using all these imaging markers, and even the non-imaging markers, they used some of the genetic markers, some of the SNPs which are associated with AMD and the demographic data, and try to develop a model which can predict where this progression will happen. This is some of the heat maps which this study had used, and it showed a AUC of 0.8. 80% of the time it could predict whether an intermediate AMD will go towards geographic atrophy. However, they found that if you add genetic features, it didn't improve. So this was just based on non-imaging features, that is OCT characteristics. If you add genetic factor, it didn't improve the prediction model. But what I wanted to show, people are using these genetic information now to create these predictive models. This was a work which we did at Shankar Nethralaya. We were working on this gene called as HERPUD1, which is associated in PCV. And we found that one of these SNP, single nucleotide polymorphism, was associated with treatment response. So when this type of a genetic change is there, it responded well to anti-VEGFs. And we are still working on that, and we have one publication there. And then we thought that why don't we develop a deep learning algorithm that we show a retinal image and it starts telling whether this polymorphism is present or not. And this was a work we did with the NTU in Singapore. And F-score was pretty good. So 85% times we could predict with a retinal photograph this type of polymorphism is present or not. So this is just a example. It can be used in multiple ways, and people are exploring these things. So few examples where the AI has improved the diagnostic capacity from the basic science point of view. So if you talk to any of the genetic people, they use this deep variant which has been developed by Google, which gives a very good, more accurate picture of a full genome. So people are using this in their labs. Just two more slides. There is another company called as Deep Genomics, which is working on pharmacogenomics, how the treatment response would be based on the genetic data, again an AI-based company. And Sophia, which has been working on cancer genetics, knowing exactly what should be the best drug treatment for individual patient. So there are a lot of applications. People are trying to explore how deep learning can be influenced in the genetics. Just to summarize, by augmenting the human performance, AI has a potential to markedly improve the productivity, efficiency, workflow. And it's not the strongest of species that survives, not the most intelligent who will survive. It's one who is most adaptable. And I think today in this era, that's what Charles Darwin said. And we as ophthalmologists, we need to adapt to this changing technology, which is very much there. And we will see this more and more in the coming years. Thank you very much.